Okay. Good morning, everybody on this side of the world, and good afternoon to everybody on Carly's side of the world. We are here again with our second episode of the Happy Hearing podcast. My name is Dr. Ruth Reisman, and I'm here with my co-host, Carly Sygrove.
Yeah, hi everybody. Nice to be back for our second episode of our Happy Hearing podcast. So Ruth, let's talk about hearing loss. What's the topic for today?
Yes, so today we wanted to discuss different types of hearing loss. And it's really interesting because something came up this week that kind of triggered some thoughts along this line about discussing hearing loss and how it really impacts the daily life. So there is a show, a very common or popular, I should say, a reality TV show called The Bachelor here in the United States. I know they have it in different countries as well, but they recently launched or released the fact that they're going to start this new series called The Golden Bachelor. And for those of you watching the podcast on YouTube, this is an image that they actually released, which was really attractive to me and very interesting. And we can see that, are you seeing the image? I'll edit this.
I'm seeing the image.
And we can see in this image that he actually is wearing a set of hearing aids, which I thought was really interesting because usually, they try to portray the bachelor as the ideal mate, your ideal candidate that everyone wants to date. And here he is really displaying what some would consider, a challenge, a handicap, or a weakness, or something like that. And I thought it was really cool that they were just so open about it and that they just put it out there and showed that it's really not something to be ashamed about or concerned about, but really something to be displayed and make others aware of.
Mm-hmm. And it's quite interesting that The Bachelor, I actually have never watched The Bachelor, everyone. I've Googled it and I've heard about it, but it's actually interesting that they've come up with this new series called The Golden Bachelor, which is focused on finding loving later life. So this is actually senior citizen, let's say, with his hearing aids. And actually the back image it's pretty cool. He looks quite smart, he looks stylish with his hearing aid.
Yeah, I would definitely agree with that. And the interesting thing, though, that I found is that this is not the first love reality TV series where individuals are portrayed having hearing loss, and not even on The Bachelor. There was recently a bachelorette. Her name was Abigail. She was presented on the show as having bilateral cochlear implants, and she was actually born deaf. So that was the first introduction in this series to hearing loss. And then we see other love series. There was actually Tasha, and she's a huge advocate for the hearing impaired, and she was on Love Island in the UK, so closer to your side of town. And she's a huge advocate for hearing loss. She actually has a podcast also called Tasha Superpowers. And she's a model. She was featured wearing her implant as a model. So I thought that was really cool. And then most recently, there's a show called The 90 Day Fiance, The Other Way. I'm a very big reality love TV show. And there's actually a couple. Yeah, I'm going to convince you to start watching them, Carly. So there's actually this couple, David and Sheila, who both have hearing loss. And it's really interesting because David was born deaf and remained in what we call like the capital D deaf community. So it's really a very culturally specific community where they don't actually get hearing aids or cochlear implants typically for their hearing loss, but use American Sign Language or whatever sign language in that region is being used as their main mode of communication. And so Sheila, who's the woman that he's pursuing, learned some sign language, which is interesting to see how she's learning that language. But they actually met on a hearing impaired Facebook group, dating Facebook group for singles. And she had hearing loss. And she explains in her story that as a young child, she actually punctured her eardrum that was never able to be repaired. And so she has profound hearing loss in one of her ears and wears a hearing aid so she can relate to David and his challenges that he experiences with hearing loss.
Wow, and how great that she's actually learning sign language to communicate with him as well.
Yeah, it's really cute to see how they connect on that. And I should really learn sign language. I think it's I think as an audiologist especially to be able to communicate. But yeah, it's interesting to see how they communicate in that way. Kind of like a hybrid between speech and their American Sign Language.
Yeah, it shows as well that there's so many different ways to communicate. It doesn't have to just be one way. You don't just have to use speech. You can use sign language. You can use all sorts of things. So, yeah.
No, for sure. And that's the beauty of it. And that's what, in terms of what we're doing here with the podcast and with communication and understanding hearing loss, what kind of challenges that may pose in communication, and how we can improve upon that to improve relationships. I think that points to that point that you're making, that there are different ways to communicate and different ways that we can connect with others. So I really thought that was interesting. That kind of sparked not only the reality love TV show, but why these shows are pointing out that these individuals have hearing loss and what kind of challenges or things that they can overcome in trying to find love, in trying to connect with other people and establish relationships. And I also thought it was interesting that each of them had somewhat of a different cause for their hearing loss or found themselves within a different community, and trying to spread awareness about their challenges and their handicaps that they grew up with, so to speak.
So today we're going to be looking at different types of hearing loss and different ways that people might get hearing loss.
Yes. So I wanted to bring that up today because I thought that if we're going to be discussing hearing loss going forward, we should all have a basis of what causes hearing loss, what are the different types of hearing loss, what are potential treatments if pursued, and when there's reason to be concerned and when there's reason to just continue on and try to find ways to improve quality of life and communication. So for those of you watching, again, this is an image of the ear. I just wanted everyone to kind of be aware that there are different parts to the ear. So much more than meets the eye on the outside. More often than not, we see this outer ear, which is called the pinna. Everyone can see that. That's typically where, if an individual is wearing a hearing aid or a cochlear implant, that's where the device sits, and that's where we can see. But the beauty of this pinna is that it kind of acts like a funnel, right? It just takes all that sound and funnels it into the remaining mechanism of the ear.
Just for the people who are listening at home, so when you're talking about the pinna, when you touch your own ear on the outside, and you can put your finger obviously in your ear, is that all classed as the pinna?
So the pinna is actually the outer portion, like you said, the portion that you can touch and feel. Okay. That hole where you potentially put your finger in, that's the beginning of the ear canal. So that's going. That's still part of the outer ear, but it is going now into the inner portion of the ear, and that's called the entryway is the ear canal.
Okay. So even though it feels like it might be described as inside the ear, it's actually still classed as the outer ear.
Correct. Yes. Okay. Yes. And that ear canal is typically where individuals have, where the earwax lies or debris builds up. And sometimes that can be a cause of sudden hearing loss, right? So not everyone is going to experience what we experienced, which was a sudden drop in the hearing coming from the inner ear or the nerve, but just even a blockage of earwax that just becomes excessive can cause a sudden drop in the hearing. And that would happen here in the ear canal in the outer portion of the ear.
Okay, so for anyone who actually has a sudden hearing loss, you do still need to see a doctor, of course, always with a sudden hearing loss, but sometimes the cause isn't necessarily from the inner ear. It can actually just be something as simple as some earwax buildup or something inside that ear canal.
Yes, that's correct. And then oftentimes the beauty of it is once we clear out the earwax and clear out the ear, more often than not, the hearing goes right back to normal. But we do always have to check the hearing afterward just to make sure that it does go back to normal and that there's not something else that we're potentially missing.
Okay.
Yeah, so that's probably the most common cause of hearing loss due to the outer ear. There are other things like outer ear infections that come often when people are to swim a lot, especially in cold water or in swim regularly in pools, because that water actually removes a lot of the earwax and the protectants of the ear and allows for infection to breed when there's a lot of moisture and there's no protection to the ear.
Okay, is that called swimmer's ear?
So yes, it can be a form of swimmer's ear. There's also something where like bony growths start to develop because of the cold water exposure, and that can sometimes just close off the ear canal. And so it's not an infection, it's just a bone overgrowth. But yes, a lot of times it's the swimmer's ear that can cause those outer ear infections that result in a lot of pain and potentially decline in hearing as well. So if we move on beyond the outer ear, which we said was the portion that we see, that pinna that we can feel and touch, and then that ear canal that we can start to penetrate with potentially our finger. I wouldn't put anything larger than that in there. We get to our eardrum. So we spoke about Sheila, who had an eardrum perforation. That eardrum is kind of like a protectant or a door or a curtain between the outer ear and what we call the middle ear. And the biggest or the most common trauma sustained to that eardrum is some sort of blunt trauma. So people putting a Q-tip in their ear, or I've seen knitting sticks when they were trying on a sweater that they were knitting. I've seen toothpicks, people thinking that they can clear out their ears with toothpicks. I've also seen individuals that sustained, head trauma, and that caused a hole in the eardrum. And sometimes, like you said, you hinted to the swimmer's ear or ear infections. When there's a really significant ear infection behind that eardrum and there's fluid that starts to build up, sometimes that can just burst the eardrum and create a hole which allows the fluid to actually drain. Sometimes that can give relief to the patient, but it may not heal on its own.
So you mentioned Q-tips, so that's cotton buds that people sometimes use to clean their ears. And I know that you're not supposed to do that, but I know that many people do clean their ears with Q-tips. So you've just actually said there you can actually perforate the eardrum from doing that.
So yeah, that's probably one of the most common ways that people perforate their eardrum. So those cotton tips or the Q-tips, if patients are very adamant about using them, I'll tell them, you can clean the outer portion of the ear, but never put it into that ear canal.
Okay, so it's something to be aware of.
Oh, for sure. Something to, to just be mindful of when clearing out the ear. wax, although, you know, it can build up and be uncomfortable, is really something that's there to protect our ear. So we don't necessarily need to get it all out with the Q-tip. As a tip, typically for patients who do build up a lot of wax, actually one of the best remedies for that is olive oil. If you don't have a hole in your eardrum, you can put a couple drops of olive oil maybe once a month, and for whatever reason, it helps melt the earwax and help to avoid that buildup or that complete blockage.
Wow, how interesting. So if somebody thinks they've got a lot of buildup in their ear, they put a couple of drops of olive oil and it'll break it down?
Yep, that's
Wow.
that's usually one of the most common at-home remedies for it, and it's an affordable way to do it without damaging the ear.
And if that doesn't work, I guess you go to your hearing healthcare professional.
Yes, so there are still patients that have a very significant buildup. Most of the time that's a genetic thing, and different patient populations will have different types of earwax, different levels of production of earwax. So yes, they'll still have to come in and get it removed regularly. But for those who can try to avoid it, using a couple, or know that they have this issue, potentially using a couple of drops of olive oil, maybe once a month or so, and putting a cotton bud over it just to drain out the wax, is helpful.
Okay. Some good tips in this episode today.
Yeah. Some of the things, and when I tell patients that, they get all excited. They're like, really, olive oil
So
from
simple.
my kitchen? Any specific type? I'm like, no, any olive oil will do. You don't need the extra virgin.
That's
type.
also good to know.
Yes. And then once we go past that eardrum, we have the middle ear. So in the last episode, I spoke about my mother who suffered from hearing loss in both ears. She had what's called otosclerosis. And when we talked about that overgrowth of bone, or that stiffening of the bone, this is where it happened, in the middle ear. We basically have three bones in our middle ear that help to transmit the signal from the outer ear. That eardrum will vibrate, and then it'll move those bones to allow for stimulation of the inner ear and the nerve. And so otosclerosis is one of the most common causes of hearing loss in that middle ear, so that overgrowth of bone. But there are some other things that can take place there, like we talked about middle ear fluid, you know, secondary to an ear infection, breaks of the bone I've seen, like when individuals sustain head trauma. And then unfortunately, growths and tumors can also happen in that area that can cause hearing loss.
Okay.
And a lot of the causes of hearing loss in the middle ear are usually treatable either through medical modalities or surgical modalities. So again, it's so hard to know when someone says, oh, I have hearing loss, what type of hearing loss do you have? What is the cause of the hearing loss? And we're ready, and I'm just brushing the surface for some of the, you know, the most common causes of it. You know, it's so hard to know and just self diagnose what the cause of the hearing loss is. It's really important to get it investigated so that you know what are your options in terms of treatment.
Because the different causes will obviously have different treatments.
Yes. When you, Carly, when you actually had your hearing loss, when it first happened, what were you thinking the cause was, or what were you thinking the reason your hearing dropped?
It's an interesting question because mine happened suddenly. I actually didn't see a doctor for about a week because I just thought, oh, it's just something that's going to clear up. I'd actually had neck problems most of my life, and I kept stretching my neck thinking, oh, it's something, because I had a lot of pain with my neck and jaw, and I thought it's something to do with that, which I don't think it was, but it was what was going through my head at the time was, oh, it must be my neck and jaw. I started stretching every night to try and like maybe pop something that would then sort my ear out. So really, I didn't think it was wax. I'd never had an issue with wax or anything like that. I didn't actually think it would be permanent. And I didn't realize that I should have seen a doctor immediately. So saying it now with everything I know, I'm like, why didn't you go? You know, I always say if you lost sight in one eye, you'd go straight to the doctor. Why didn't you go? But you know, it happens, and I wasn't immediately alerted. I wasn't like thinking it was something that bad, really. So yeah.
Yeah, I think that's it's a common thought process. A lot of people that step into the office with sudden hearing loss like that say, oh, I just thought, my ear was clogged, like how I feel when I got off the plane.
Yeah. And I was thinking, oh, I'm quite tired. Maybe I'm just really tired, or maybe I'm a bit stressed. Maybe, I'll have a sleep, I'll go to sleep and tomorrow it'll be okay. And yeah, it wasn't. But I think there's a point made there that, you should really, any kind of change in hearing, whatever cause it may be, firstly, you don't know the cause probably. Secondly, get it checked out because it's important, because usually often with these things, the sooner the treatment, the better.
I would definitely, that's great advice. And I would definitely agree with that statement, because it can be something as simple as wax, but it could also be something as challenging as a sudden sensory neural hearing loss that potentially is time sensitive in its treatment.
Yeah, exactly.
So then once we go past the middle ear and where we spoke about, ear infections, potential overgrowths of bone, or even breakage of the bone that happens sometimes when there's head injury, then we get into the inner ear, which is the cochlea, that controls both hearing and balance. And then the eighth nerve, which again is the nerve that innervates both the sensory hearing organ and the balance organ. And from that nerve, that'll go up all the way into the central auditory pathways of the brain, going to the temporal lobe where Heschel's gyrus sits, and that's where information gets processed. So when we're talking about hearing loss that's coming from the inner ear and the nerve, we know there are just so many causes for that. A lot of times it's genetic, individuals that are born with it. So even our bachelors, our bachelorettes, and those individuals looking for love, a lot of them did start out with genetic hearing loss, but other things like our golden bachelor, where maybe it's potentially an age-related thing, or like what we had, a sudden loss with no real cause for it.
I think it's really, since it's so intricate, there's so much involved in the ear, it's really important that we don't, like you said earlier, try and self-diagnose, because even if you think it's one thing, even if you think, oh, it's just earwax, I always have earwax, and maybe you're thinking that, but maybe it's not. So I think that's quite important. It's just that don't self-diagnose. If you're worried about anything, if anything changes, and you're not we're not the doctor, go and see the doctors.
Sure. Yeah. And it's really interesting, that analogy that you made. Like if we lost vision in one of our eyes, we would immediately go to the doctor because we know something is not right. And it's interesting how individuals with hearing, on the most part, don't put that same level of importance on the hearing. And I'm always so curious as to why that is, because hearing is one of our 5 senses, just like vision would be.
I think until I lost my hearing, I actually didn't realize how important it was to me. So now I realize how important it is with, not just with communication, but with music, particularly. Music doesn't sound the same anymore. Just with like being safe in my environment, having like connections. And I think I think it's sometimes a case of you don't really realize what you've got till it's gone. And that was definitely the case for me. So it is an interesting point, though, that difference between the way we view our sight and the way we view our hearing.
For sure. And I think that's one of the beauties of this type of podcast and others who are going out to spread the awareness is that, we really need to make hearing as important as all of our other senses, because like you said, you don't really know how important it is until ultimately, potentially it's gone or you lose it temporarily, and then realize the importance afterward. And just some of the other things related to inner ear and nerve hearing loss, there are a lot of medications that can potentially affect the hearing. So to be aware of different side effects of medications. We all know loud noise exposure. So music, loud music, concerts, working in environments with loud noise in terms of protecting the hearing, because like we said, you don't know how much you need it until eventually it's gone. And sometimes it happens gradually and you don't realize it until it's so significant that it's now impacting your quality of life.
Exactly. One thing that's always mentioned in my Facebook group is that when people have lost their hearing, whether it's sudden or gradual, then they've lost so much more than their hearing. It's not just losing sound, but for some people it's losing confidence, it's losing connections, it's it's losing those things that you love. Sometimes it interferes with your social life. You lose a lot more than just hearing.
I would see how that can happen, and like we said, just starting from the beginning and kind of going full circle here is like, these love shows, why are they actually highlighting these individuals with hearing loss? In my opinion, I think it's because they're trying to show how we can maintain the human connection and why it's so important in trying to find our partner or in trying to communicate with others, and some of the struggles that potentially they are experiencing and how to overcome those struggles in order to maintain that connection or develop that connection with others, and how hearing plays such a large role in that.
Showing it in a positive light, and I think that gives a lot of people hope.
I would agree. I was actually looking at a lot of the comments when that picture of the Golden Bachelor was released, and how everyone was excited that they were actually portraying hearing loss, and some people on there shared their story about their child that had hearing loss, or they had hearing loss, or a family member, and how that immediately connected with them and they felt kind of heard or seen, in a sense, with it being portrayed in this way.
It gives people positive role models as well, doesn't it?
For sure, for sure. And then, we did speak about the anatomy and different causes for hearing loss just based on anatomical things or mechanical things. But what's really interesting, and I work a lot of this with this in my private practice, is there are individuals that have completely normal mechanisms, completely normal hearing, that once we get to the level of the brain, so that's the final portion along that pathway, where everything ends and also begins and comes, in terms of the bottom up processing portion of it. And they have what we consider either an auditory processing challenge or a central type of hearing loss, where the deficit is actually not coming from any mechanism or any weakness in their anatomy, but actually in the functionalities and the processing at the level of the brain. And to me, that's in some ways some of the most interesting types of hearing challenges, because we're like, okay, the mechanism is functioning properly, just like the eye is seeing, right? Why are we, for those who have dyslexia, why is it that the letters are backwards? Or for those who have auditory processing, why is the auditory information not being processed appropriately so that they can not only hear but understand what's being said?
That understanding part is missing, isn't it? So the ear's working, but that understanding isn't working how it should be.
Yeah. And then once you add, we don't live in a silent world. Obviously, there's always background noise. Even in a restaurant, the background noise can be someone else speaking, right? So that just adds a lot of added layers of challenges for those individuals that, unless things are in complete isolation, they have difficulty hearing or understanding what's being said.
Mm.
So we have patients that when we do their therapy and then we give them a word with just auditory only, basically sound only, and we want them to try to repeat the word back, and they're not able to because there's background noise or there's someone else speaking, and then they see the word, they're like, I can't believe that was the word that I was actually supposed to be hearing. Because, you know, let's say, for example, you're saying red and I heard rod. And even if you said red a million times, to me, it would still sound like rod, 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 rod. And I would have never gotten the word or the context or the understanding of what you were saying.
Right, so interesting the way the brain works.
It really is. And so with those types of patients, you know, it's not a cochlear implant or a hearing aid, like we showed with our other examples. In those types of patients, we actually have to now do therapy and rehabilitate the individual pathways of those phonemes, of the different sounds. And then when we do that, the question is, does it translate to other languages? Because I have patients that have this challenge and they're trying to learn a second language, which I'm sure you can understand, you know,
Yep.
being in Spain. And, you know, if we rehabilitate it in one language, does it translate over to the other language?
And what have you found?
So in some cases, yes. And for some patients, we work on both simultaneously. So, and the best way to do that is to take the hearing information. What does the sound, the phoneme sound like, with the grapheme? What does it look like? And then taking those two and putting it together and making those neural network connections in the brain is what's helpful. And we'll kind of connect it to the primary language that the patient is most familiar with, and then make a secondary network to the new language that they're trying to learn, so that they can make very strong integrated pathways in their brain, in their mind, so that they can quickly recall what's being said, even if they're in a challenging setting.
Okay, so having that visual with the audio as well and trying to help make those connections using that.
Yeah, we start audio only because that's what we're trying to train, but then we give them the visual so that they can connect the two. And it's helpful even for children that are, you know, learning to read and having difficulties reading, or children who have the dyslexia where the letters are backwards and it doesn't really, in terms of what they're reading, what they're hearing, what they're saying, doesn't really connect. This form of therapy really helps them to make those neural networks and reinforce them so that communication, listening, hearing, connecting is just more effortless.
I used to be an early years teacher, so I used to teach 3 and 4 year olds, and I used to teach reading and writing, and we used to have flashcards with the phonics flashcards with your phonemes and graphemes on, and it sounds very similar to what you're doing with your patients, is saying the sound at the same time as presenting how the sound looks to the children as well. So it helps with the reading and writing, because it shows them how it needs to look while how it needs to sound, and that kind of, again, it must be creating those pathways in the brain to help them with that.
For sure. And that's some of the challenge, because sometimes our patients, especially our adult patients, feel like it's very elementary in terms of what we're doing with the therapy. But it's every week building up on more information. So it starts very basic level, but then we just task the brain and task the system more and more, in background noise, in signals that are degraded, in removing the visual portion and just leaving the auditory portion. And so every time we task the brain and challenge it, we allow them to achieve a new level of processing.
super interesting, and super interesting how it crosses over to what I'm thinking. I'm just thinking of the classroom experience and how there must be a big similarities there in teaching children to read and in the kind of auditory processing therapy that you're doing as well.
Yeah, there are definitely a lot of parallels in that arena. But I thought this was a lot of fun talking about the different causes of hearing loss and how we were able to connect it, and how, you know, hearing loss is getting attention in the media as a, you know, as something that we need to increase awareness about and be open and talking about.
Yeah, I'm so glad to see more people with hearing loss and different types of hearing instruments, treatment, cochlear implants, hearing aids. It's great. It's great having these role models, and it just makes it normal. It brings it into the public space. It makes it normal. It shows people a different way of communicating, and that's great.
I would agree. And the hope is that, you know, it becomes as important as all of the other senses, and that there are professionals like myself and you who are here to help individuals overcome any challenges that they do experience with it, and know that, like you said, it's normal. It's normal, and there are ways to improve the quality of life and make communication and connecting a little easier, even if that challenge is present.
Exactly.
Well, thank you so much, Carly, for sharing the time today. As always, I love talking to you, and I love having these discussions. And I think it's really important getting this information out there. And I'm excited to spread the awareness to our listeners.
Thanks, Ruth. Thanks for the information about the ear, and a little bit about you know, some reality TV programs as well.
I gave you some ideas.
Yes, you have.
We'll circle back and get your insight afterward, after you watch them.
All right.
Okay,
then.
have a great day, Carly. It was so good connecting again.
You too. Thanks, Ruth. Bye.
Pleasure. Bye.